We are delighted to have Dr. Latanya Takla open up our day with an overview of adverse childhood experiences and how they impact our lifespan. Dr. Takla is a licensed MFT and the director of the Spark Center Inclusive Mental Health Initiative. Welcome, Dr. Takla.
Thank you. Could I get screen sharing? I just have a few slides for those who are on video to see.
I think you should have that capability now.
Oh, great. Okay. All right. So of course, I'm honored to be an opening presenter here to talk about adverse childhood experiences. I'm just going to be giving a very brief introduction overview for those of you who haven't heard about the impact of adverse childhood experience, which we call ACEs, and how it affects disproportionately communities of color and just families who have a high level of stress, I would say. Clinically, we often say, oh, family dysfunction, but we're gonna look at it from a perspective today of just stress and what we can do about it. So what is ACEs? So this is just a general overview of it. This is a study back in the 90s that was conducted with Kaiser and the Center for Disease Control. And it was a big study. 17,000 people participated. And they focused on traumatic childhood events, household dysfunctions, and health outcomes in adulthood. There was a notice that, well, something's going on with a certain group of people, higher rates of diabetes and other high blood pressure. There was a lot of physical ailments noticed in a group of people that had childhood incidents that were stressful and traumatic. And then they looked at over time, what were the outcomes for these folks into adulthood, and they were really severely, disabled in a lot of ways in terms of having symptoms of what we call post-traumatic stress disorder, also substance abuse, educational disparities, having difficulties going to school and focusing. And so the thought is that we need to intervene. So all this research came out of ACEs, and now we're looking at how to treat it. So the questions that they originally asked were about neglect, abuse, and the type of household that someone might have come from. And this information has been helping the medical field, as well as directing mental health services to help people recover and to try to stop these things before they start. So some of the questions they asked were things in this ACE questionnaires about abuse in the household, emotional, physical, sexual abuse. They asked things like, is there a step parent or adult living in your home who swore at you, insulted you, put you down, made you afraid, or physically hurt you? So those are the type of questions that were asked. They also asked questions about, was your mother treated violently, or stepmother, or was anybody pushed or grabbed or thrown in your household? Because they found that people who were raised in households that had domestic violence were at higher rates of becoming physically ill or emotionally ill. They also asked about substance abuse. They asked, are there drinkers in the household? Was anybody using drugs? What did you know about that growing up? And so those questions were important because substance abuse was highly linked to adverse childhood experiences, which then causes medical concerns down the line and mental health concerns. They also asked questions about the mental health in the household. Was anybody depressed? Were they mentally ill? Did anybody attempt suicide? Was there any divorce in the household? Was there anybody in the household that went to jail who's incarcerated? And because they also found that households that had these dynamics going on and a member of the household in prison or jail also caused the ACEs score to go up, and more emotional and physical problems from that. So from these questions came a lot of statistics that were not the best, specifically for communities of color. And so let's look at the impact. So what they found was that the impact was great in all these areas that are listed. So here we have 7 areas listed. And then they also found some commonalities, which was across all populations, almost 2/3 of the study participants had at least one adverse childhood experience in their lifetime. And a lot of people reported more than 5 of them as they grew up. So in this slide, you can see all the different areas. We have mental health, we have infectious diseases, we have chronic diseases, we have risky behaviors, we have opportunities in academics. So all these areas are really affected. And then we also have like traumatic brain injuries, fractures, burns, and things of that nature. So when the ACE score is high because of adverse childhood experiences, that the outcomes for your health are not that great. And so, and then recently, they've been looking at like who's being affected. And the recent studies show that the vulnerable folks are the folks that don't have a whole lot of money. They are in low income areas. They don't have places where kids don't have places where they can safely play, either do adults, and they work and live in stressful environments. And that brings us back to communities of color that are economically disadvantaged. So there's many racial disparities amongst folks of color because we're disproportionately affected. So then, of course, we end up with all these challenges. In Philadelphia, they had a follow-up study that added to the original ACEs study, and these are some of the outcomes there. So in the original study, the 17,000 participants, this one had close to 2,000, and it was the Philadelphia ACEs project. And in this study, there was 83% of the participants in that particular area had an adverse childhood experience. And so in that particular area, they had more health concerns. This slide shows the broader community and the challenges that are faced. So it expanded the view of what's happening. So when we expand it, we're looking at racism, bullying, community violence, neighborhood safety, and living in foster care. And the findings here was that these things increase adverse childhood experiences even more. So then that study actually highlighted more occurrences and more illness within communities of color. Then we look at this is sort of like, how does this happen? Well, this at the base you have historical trauma, and then you look at social conditions, and then you look at these adverse childhood experiences, the ACEs. And then you look at problems in utero when children are born. You look at the mother's stress level and lack of support and resources, and parent stress, especially if the fathers are going to jail, and now the mothers at high rates. And then we look at health and behavior, and how when you come from environments like that, how does it affect you behaviorally? And then we look at the outcomes of disease, disability, and social problems. And then that just leads to early death. So we really want to intervene sooner than later. So as bad as this story looks, there is help and support. And so I want to look at prevention now. So this is a prevention slide of all the things we can do to kind of reverse this or stop it before it starts. So we want to look at strengthening economic support in families and communities. Um, we want to look at increasing social support to parents. We want to provide quality care and education, like early childhood education. That helps a lot. We want to look at preventing illnesses. We want to look at, changing our medical system so people of color specifically can get fair treatment, like where we're talking about everything being equitable. We also want to look at, prevention from risk, because we know what the risk factors are. We just have to do something about it. And I highly recommend, when I look at all of this, what I see as a psychologist is I see stress. So I highly recommend counseling, support, more community involvement. I know in certain communities, counseling is the thing most people want to do, but it is something that really, really helps. So education, financial support, and getting that emotional and mental support so your stress level can go down. Because decreasing stress also helps your organs work better, and it just helps you with overall health. And I'll turn it back over to Angelina. And I thank you for listening.
Wonderful. Thank you, Dr. Takla. Definitely, we want to make sure that moving forward that we are mindful that not everyone experiences this life the same way, and that everyone could definitely use someone to talk to help process through things. And what we're learning is, what the experts are learning is that trauma is not exclusive to a certain ethnicity, a certain racial group, a certain creed, etc. Trauma happens at all levels of society in varying ways. It just seems to happen to people who are socioeconomically disadvantaged at a higher rate. Okay. Again, thank you, Dr. Takla. It was wonderful having you with us.